3 minutes to the command briefing. 3 minutes.
I'm thinking that there's nothing we're going to do for her right now in there.
But we need to figure out why you push her.
This was hands-on versus theoretical, which we do a lot of.
We work really hard to standardize things that we do, and we haven't been able to do that at this scale in New Hampshire. So it gives us an opportunity to all learn together.
Really good job. You're okay, friend.
We got the numbers. They were a little bit different than what the media was reporting. So if we're able to say, as of at this time.
Each person's from a different hospital, so they don't get the opportunity to practice the ICS, the HICS, that we've already learned at each individual hospital, that they employ at each individual hospital. So they were able to learn from each other and each other's practices at home.
From all the other hospitals from New Hampshire, those 17 different communities could share ideas, and we could also start to network. And so now when I have a question, I have a face and a name that I can call up at another hospital in one of my own local communities to problem solve, to plan, maybe even to do some joint exercise in the future. So it really opened some nice doors for us.
We've done a lot in the state through the coalition, working to get consistent with everything from decon equipment to codes to everything else. We try and be very consistent across the organizations. And for everybody to come in, hear the same thing, apply the same lessons. You know, practice makes permanent. We got to practice, and everybody practiced the same way, learn the same lessons.
Going down!
We can actually have this patient grab a seat if we can, because it's an isolated ortho injury that we fixed.
Pain meds?
The goal is to save lives, so that way when they get into the hospital they can be treated. So we're going to take our time and make sure there's nothing left on our patient in this area.
I thought this would be a good idea because I heard it word of mouth from my counterpart in Pennsylvania. They had already done it and said it was the most fantastic training they had ever received altogether.
No.
Take care of it. Belly. Butch, Dr. Scott, how are you, sir? Take a deep breath for me.
That they need to start cycling their staff out of there, because staff are just going to get exhausted.
Hey, listen, what we do? We put him on his back.
We need our iron back.
Count 3.